Have you been taking amlodipine every day? What if I told you that one simple mistake, something many people do without even thinking, could make your medication less effective, increase unwanted side effects, or even put your health at risk? The surprising part is that most people are never warned about these common mistakes, and if you're over the age of 50, understanding them becomes even more important because our bodies process medications differently as we age. In today's video, we're going to uncover 5 dangerous mistakes people commonly make while taking amlodipine and, more importantly, what you should do instead to help keep your blood pressure under control and protect your heart. Be sure to stay until the very end because the 5th mistake is one of the most overlooked, and it could affect thousands of people every single day. If this is your first time, please hit the like button so YouTube recommends this video to others who need it, and subscribe so you don't have to miss any of our videos. Now, let's get started. If you're taking amlodipine, or if someone you love is, this video could be one of the most important health guides you'll watch this year. Amlodipine is one of the most commonly prescribed medications for high blood pressure and certain heart conditions. Millions of people rely on it every day because, when taken correctly, it can significantly lower the risk of heart attacks, strokes, kidney damage, and other serious complications related to uncontrolled blood pressure. But here's something many people don't realize. Taking the medication is only part of the equation. The way you take it, what you eat, the other medications you use, and even certain daily habits can all influence how well amlodipine works. Some mistakes may seem harmless, but over time, they can reduce the medication's effectiveness or increase the likelihood of side effects such as dizziness, swelling in the ankles, headaches, or dangerously low blood pressure. The good news? Most of these problems are completely preventable once you know what to look for. So let's begin with the first, and perhaps the most surprising, mistake. Mistake number 1, drinking grapefruit juice. Imagine starting your morning with a healthy breakfast. Maybe you've prepared oatmeal, fresh fruit, and a refreshing glass of grapefruit juice because you've heard it's packed with vitamins. It certainly sounds like a healthy choice, but if you're taking amlodipine, that seemingly healthy habit may not be the best idea. Here's why. Your body uses enzymes in the liver and intestines to break down many medications. One of these enzymes is responsible for helping process amlodipine. Compounds found in grapefruit and grapefruit juice can interfere with this enzyme, causing higher levels of the medication to remain in your bloodstream for longer than intended. When this happens, the medication may have a stronger effect than expected. That can increase the likelihood of side effects such as feeling lightheaded when standing up, dizziness, flushing, headaches, low blood pressure, increased swelling in the ankles or feet. Now, it's important to know that the interaction between grapefruit and amlodipine isn't as pronounced as it is with some other medications, but many healthcare professionals still recommend limiting or avoiding grapefruit products unless your own doctor or pharmacist has advised otherwise. The safest approach? If you enjoy citrus fruits, consider alternatives such as oranges, tangerines, or apples instead. If grapefruit is a regular part of your diet, don't stop your medication on your own. Simply discuss it with your healthcare provider, who can advise you based on your specific situation. That's a much safer approach than guessing. And that brings us to the second mistake, a habit that many people believe is helping their blood pressure, when, in reality, it may be doing the opposite. Mistake number 2, skipping doses or taking it at different times every day. Now let's talk about one of the biggest reasons many people struggle to keep their blood pressure under control, even while taking their medication. It isn't always because the medication isn't working. Often, it's because it's not being taken consistently. Here's a common example. John is 68 years old and has been taking amlodipine for over a year. On weekdays, he remembers to take it with breakfast, but on weekends, he sleeps in and doesn't take it until lunchtime. Sometimes, if he's busy or out with friends, he forgets entirely and doubles the next day's dose, thinking it will make up for the missed one. Unfortunately, this is a mistake that many people make. Although amlodipine stays in the body longer than many blood pressure medications, it still works best when taken consistently. Taking it at roughly the same time every day helps maintain a steady level of the medication in your bloodstream. When you skip doses or take them at random times, your blood pressure can become less stable. That means it may rise when you least expect it, increasing the risk of complications over time. The tricky part is that high blood pressure is often called the silent killer, because you usually can't feel it. You may think everything is fine while your blood pressure is quietly climbing. Another mistake people make is taking 2 doses at once after forgetting one. This can increase the risk of side effects, such as feeling faint or dizzy, a sudden drop in blood pressure, weakness, increased swelling in the feet or ankles. If you realize you've missed a dose, follow the instructions provided by your doctor or the medication label. In many cases, if it's close to the time for your next scheduled dose, you'll simply skip the missed one and continue your normal routine. Avoid taking extra tablets unless you've been specifically instructed to do so by your healthcare provider. One of the easiest ways to stay on track is to make amlodipine part of your daily routine. For example, take it after brushing your teeth in the morning. Keep it in a safe, visible place where you'll remember it. Use a weekly pill organizer. Set a daily alarm or reminder on your phone. These simple habits can make a big difference in keeping your blood pressure stable and reducing your long-term risk of heart disease and stroke. But consistency isn't the only thing that matters. The next mistake involves something many people buy over the counter without giving it a second thought, and it could interfere with your blood pressure control. Let's take a look at mistake number 3. Taking certain over-the-counter medications without checking first. Now, here's a mistake that surprises many people. Imagine you wake up with a headache, sore back, or aching knees. You stop by the pharmacy and pick up a common pain reliever, thinking, it's sold without a prescription, so it must be safe. But if you're taking amlodipine, that's not always true. Some over-the-counter medications can affect your blood pressure or interact with your treatment in ways many people don't realize. One group of medications to be especially aware of is non-steroidal anti-inflammatory drugs, often called NSAIDs. These include common pain relievers such as ibuprofen and naproxen. For some people, especially older adults or those with kidney disease, heart failure, or high blood pressure, frequent use of these medications may reduce the effectiveness of blood pressure medicines and may even cause blood pressure to rise. That doesn't necessarily mean everyone should avoid them completely. In some situations, your healthcare provider may recommend them for short-term use. The important point is not to assume they're harmless simply because they're available without a prescription. Cold and flu medications can also be a concern. Some decongestants can narrow blood vessels, making it harder to keep blood pressure under control. If you have hypertension, always read the label carefully or ask your pharmacist which products are safer for you. And don't forget about herbal supplements. Many people believe that natural automatically means safe. Unfortunately, that's not always the case. Some herbal products and dietary supplements may affect blood pressure or interact with prescription medications. Even certain weight loss supplements, energy boosters, or high-dose vitamins may not be appropriate for everyone. This is why it's so important to let your healthcare provider know about everything you take, not just prescription medications. That includes vitamins, herbal supplements, pain relievers, cold medicines, sleep aids, antacids, any other over-the-counter products. Keeping an updated list of your medications and supplements can help prevent unwanted interactions and make every doctor's visit more productive. Here's a good rule to remember. Before starting any new medication, vitamin, or supplement, ask your doctor or pharmacist if it's safe to take with amlodipine. That one simple question could save you from unnecessary side effects and help your treatment work as intended. Now, if you think that's an easy mistake to make, wait until you hear the fourth one. It's something many people do every day without realizing it could increase one of amlodipine's most common side effects. Mistake number 4, ignoring swollen feet and ankles. Now let's talk about one of the most common side effects of amlodipine, one that many people notice but often ignore. Imagine this. After several weeks of taking your medication, you look down at your feet one evening and realize your socks are leaving deeper marks than usual. Your shoes suddenly feel tighter. Maybe your ankles look puffier than they did a month ago. At first you think, it's probably just because I've been standing all day, so you ignore it. Days turn into weeks and the swelling continues. Here's the thing. Amlodipine works by relaxing and widening your blood vessels, allowing blood to flow more easily and helping lower your blood pressure. While that's exactly what makes the medication effective, it can also allow a small amount of fluid to leak into the surrounding tissues, particularly in the feet and ankles. This is why swelling, also called peripheral edema, is one of the most commonly reported side effects of amlodipine. For many people, the swelling is mild and not dangerous. However, it should never be ignored, especially if it's new, worsening, or making it difficult to walk or wear your usual shoes. One mistake some people make is stopping their medication immediately because they notice swelling. This can be risky. Stopping amlodipine without medical guidance may cause your blood pressure to rise again, increasing your risk of heart attack or stroke. Instead, contact your healthcare provider. Depending on your situation, they may adjust your dose, recommend a different blood pressure medication, add another medication that helps reduce swelling, evaluate whether the swelling has another cause. Remember, not all swelling is caused by amlodipine. Swollen legs or ankles can also be related to heart disease, kidney disease, liver problems, poor circulation, or blood clots. That's why it's important not to diagnose yourself. There are also a few simple lifestyle habits that may help reduce mild swelling. Elevate your feet when sitting for long periods. Stay physically active with regular walking if your doctor says it's safe. Avoid sitting or standing in one position for too long. Wear comfortable shoes that don't restrict circulation. Follow your healthcare provider's advice about salt intake. Now, here's an important warning. If swelling is accompanied by shortness of breath, chest pain, severe dizziness, fainting, or swelling that develops very suddenly, seek medical attention right away. Those symptoms may indicate a more serious condition that requires prompt evaluation. The key takeaway is this. Don't panic if you notice swelling, but don't ignore it either. Your doctor can help determine whether it's a common medication side effect or something else that needs attention. Now we've reached the 5th and final mistake. Ironically, it's something many people think is helping their blood pressure, but it may actually be working against the medication. And it's one of the easiest mistakes to fix once you know what it is. Mistake number 5, relying only on medication while ignoring healthy lifestyle habits. We've reached the final mistake, and in many ways, it's the most important one. It's a mistake that's incredibly common because it's easy to believe that once you start taking medication, the hard work is done. But that's simply not how high blood pressure works. Imagine two people, both prescribed amlodipine. The first person takes the medication every day but continues eating large amounts of salty, processed foods, rarely exercises, doesn't get enough sleep, and often feels overwhelmed by stress. The second person also takes amlodipine consistently, but they make small, realistic lifestyle changes. They choose healthier meals more often, go for a 20 to 30-minute walk most days, stay hydrated, manage stress, and attend regular medical checkups. Months later, who do you think is more likely to have better blood pressure control and a lower risk of heart attack or stroke? For most people, it's the second person. That's because amlodipine is a powerful tool, but it works best when it's combined with healthy daily habits. Medication can help lower your blood pressure, but it can't completely cancel out the effects of an unhealthy lifestyle. Here are a few habits that can make a meaningful difference. 1. Reduce excess salt. Too much sodium can cause your body to retain fluid, making it harder to control blood pressure. Many people don't realize that most sodium comes from packaged and processed foods, not just the salt shaker on the table. Reading nutrition labels and choosing lower sodium options whenever possible can make a big difference over time. 2. Stay physically active. You don't have to run marathons. Even moderate activities such as walking, swimming, gardening, or gentle cycling can improve heart health, circulation, and blood pressure. Always choose activities that are appropriate for your fitness level and discuss any new exercise program with your healthcare provider, especially if you have other medical conditions. 3. Maintain a healthy weight. Even modest weight loss can help reduce blood pressure in people who are overweight. The goal isn't perfection, it's progress. Small, consistent improvements often lead to lasting results. 4. Don't smoke. Smoking damages blood vessels and significantly increases the risk of heart disease and stroke. If you smoke, quitting is one of the best decisions you can make for your overall health. 5. Limit alcohol. Drinking too much alcohol can raise blood pressure and may increase side effects like dizziness while taking amlodipine. If you drink alcohol, do so in moderation and ask your healthcare provider whether it's appropriate based on your health and medications. 6. Keep your follow-up appointments. One of the biggest mistakes isn't what happens at home, it's skipping regular checkups. Your healthcare provider may need to monitor your blood pressure, check for side effects, adjust your dosage if necessary, review your other medications, evaluate your overall heart health. These visits help ensure your treatment continues to work safely and effectively. While amlodipine is generally considered safe and effective for most people, there are certain symptoms that should never be ignored. Contact your healthcare provider promptly if you experience persistent or worsening swelling in your feet or ankles, frequent dizziness or lightheadedness, severe headaches that don't improve, unusual fatigue or weakness, a heartbeat that feels unusually fast, slow, or irregular, and seek emergency medical attention immediately if you experience chest pain, difficulty breathing, fainting, signs of a stroke such as sudden weakness on one side, trouble speaking, facial drooping, or sudden vision changes. These symptoms may not always be caused by amlodipine, but they should always be evaluated without delay. Let's quickly review the 5 dangerous mistakes we've covered today. Number 1. Drinking grapefruit or grapefruit juice without first checking with your healthcare provider. Number 2. Skipping doses, taking your medication at inconsistent times, or doubling up after missing a dose. Number 3. Taking over-the-counter medicines, herbal supplements, or vitamins without checking for possible interactions. Number 4. ignoring swollen feet or ankles, or stopping your medication without speaking to your doctor. And number 5, depending only on medication while neglecting healthy lifestyle habits that help keep your blood pressure under control. The good news is that each of these mistakes is preventable. By staying informed, taking your medication as prescribed, and working closely with your healthcare provider, you can help your treatment work more effectively and reduce your risk of serious complications. Remember, the goal isn't simply to take medicine. The goal is to protect your heart, your brain, your kidneys, and your quality of life for many years to come. Before you go, I'd love for you to become part of the Healthy Aging with Olivia family. Subscribe, like this video, and leave a comment below. I'd love to hear from you. How long have you been taking amlodipine, and what has your experience been like? Your story may encourage someone else who is going through the same journey. Your support helps us continue creating quality health content that empowers people to age confidently, make informed decisions, and live healthier lives. And if there's a health topic you'd like us to cover in a future video, let us know in the comments. We may feature it in an upcoming episode. Thank you so much for watching, and remember, the more you understand your body and your health, the better equipped you are to live a longer, healthier, and more fulfilling life. Until then, see you in the next video.